if you're trying to learn about Medicare, you're going to want to pay attention to this. I think looking at a timeline on the different parts of Medicare, it's going to give you a great understanding of how Medicare works. Now, click here if you want to learn more or connect from me, but let's go through this timeline. In 1965, Medicare was first introduced. You have Medicare Part A, which is your hospital coverage, and Medicare Part B, which is your doctor/medical coverage. And that's all that was offered. So that's how we get the term Original Medicare. Medicare Part A and Medicare Part B, and any care or healthcare coverage that you were getting is going to be handled by the Centers for Medicare and Medicaid Services. Now, in the late 1990s, Medicare Part C was first introduced, and Medicare Part C is Medicare Advantage. And what it is it's an alternative to Original Medicare. It is managed care. You have Medicare Part A and B, but instead of it being handled by the Centers for Medicare and Medicaid Services, you're choosing to have a private insurance company handle your care. So effectively, what's been created here are two systems. You have a path, and you have to choose which path are you going to take. Are you going to stick with Original Medicare and the Centers for Medicare and Medicaid Services, or are you going to have your Part A and Part B managed by a private insurance company? Now, if you look above my head, you see a Post-it note, and it says Medicare Part D. Believe it or not, prescription drug coverage from like a Walgreens or a CVS was not offered or introduced until 2006 to be covered by Medicare. So if you want Part D coverage, that is an additional step you have to take if you're in Original Medicare. Because what's going to happen is you sign up for Medicare Part A, you sign up for B, you may consider getting a supplement or a Medigap plan, which is the same thing, and then you also have to choose a Part D plan. If in the alternative you go with Medicare Part C or Medicare Advantage, typically the Part D plans are going to be built in, although there are some Medicare Advantage plans that don't have Part D in the plan. So basically, you're either going to have a Medicare supplement that fills in the dollar gaps of Original Medicare, or you're going to have this Medicare Advantage plan. And if you're in a Medicare Advantage plan, you do not get a Medicare supplement policy. So which path is the right one for you? There's a lot of learning to do, and that's why you want to watch videos, read articles, books, and also find an agent who knows this stuff that can help and guide you to figure out what's best for you.